There are so many reasons why Weill Cornell is a great place to do research.
It's amazing how many collaborations this university has across New York City.
This is really the premier place for translational medicine to happen.
Our biggest breakthroughs are those that connect the lab bench to the bedside and the genetics to the clinical treatments.
It's a particular privilege, I think, to have this kind of global scientific collaborative community in one place.
This is one of the highest concentrations of biomedical researchers in the country, here on the corner of 68th Street and York Avenue.
This tri-institutional enclave pretty much makes it about the best place to do science in the entire globe.
Of all the resources that we have, the individuals are the most important.
The students generate this real passion for the science that we all have, but with every new student and every new idea, it just emerges.
We've been able to collaborate with Ithaca investigators in a sort of seamless and collegial way that is something that I've never witnessed before in my life as a scientist.
The new medical research building is very, very important for Weill Cornell. It's going to double our research space, enable us to attract physician scientists from around the world to come work at Weill Cornell and to help all of us advance medicine and knowledge.
We're on the cusp of, I think, a revolution in science.
Things are changing. We're able to turn science into medicine much faster.
The human genome has been sequenced, and now we have this wealth of information at our fingertips, and we just need to use it.
This is a fascinating point for scientists and clinicians to get together and in real time go back and forth between the bench and the bedside.
The technology allows us to look into areas with resolution that we've never been able to do before, and that's incredibly exciting.
We are starting to be able to put together information and ideas that wouldn't have been possible in the past.
We're finally beginning to recognize the benefits of looking from molecule all the way to bedside treatment.
What's happening at Weill Cornell? We'll be able to reduce the mortality. We'll be able to increase the survival. We'll be able to also improve the quality of life in these patients.
My colleagues at Weill Cornell and I have been able to make huge breakthroughs in the health status of our patients.
Now, basic science can be translated into real-world therapies.
Now we believe we can actually find the signs of the disease well before patients actually manifest the symptoms of Alzheimer's disease.
We screened thousands of drugs, and we found one, an anti-inflammatory, that is effective at killing Mycobacterium tuberculosis.
There are two subtypes of leukemia that have gone from deadly to curable, and those transitions have been because of incredible interactions between basic scientists and clinicians.
The idea is to accelerate our understanding of disease so we can move from bench to bedside more quickly.
Imagine a patient with Alzheimer's disease who has slipped just beyond the point of contact. Imagine if we knew what we should do to bring them back for a year so they can continue to talk and interact with their family and smile at their grandchildren and call them by name.
This is a time when never before have we seen disciplines coming together to try to fight certain diseases. It's like no other time in history.
There's no question about it that research does equal cures.
Weill Cornell has just opened up the horizons of our research and really made everything that we've done in the last few years possible.
You get up in the morning and you're excited about the new discoveries that are going to be made, and I think the future is unlimited.
By supporting this campaign in each of these areas, we'll be able to bring in new researchers who are carrying out research that can have a clinical application, but who also will be involved in teaching our students, teaching our residents, and in collaborating with clinicians who will deliver this care to our patient population. So ultimately, it's our students, our residents, and our patients who will benefit from the investment